Yeah, we're here at the Camino Health Center in University City. It's a nonprofit clinic that treats both the uninsured and the underinsured. Camino calling itself a place of hope and healing.
An appointment? Yeah, we do.
Offering low-cost or no-cost healthcare appointments primarily to Charlotte's Latino and immigrant community.
The people we serve come with a dream.
Las personas que servimos vienen con sueños.
They come with amazing values.
Vienen con grandes valores.
And they end up being incredible contributors back to our society.
Que terminan siendo los contribuidores grandes de vuelta a la sociedad.
We're seeing whole families come with young children.
Vemos familias grandes que vienen con niños pequeños.
Camino founder Rusty Price talks about his staff's trip to the U.S.-Mexican border, also seeing where so many of the families they treat here in Charlotte come from, and where so many more are on the way.
Exactly. This big wave is coming. The first part is here.
Me dan servicio médico, me dan las vacunas.
They give me medical services, they give me my vaccines.
Y a un bajo costo.
At low cost.
Sylvia Banos made her trip from Mexico to Charlotte 17 years ago. She's her family's abuela, a stay-at-home grandmother who takes care of her daughter's kids, Sylvia's granddaughters, while their mom and dad are working.
Y la más pequeña se llama Lía y tiene 7 años.
And the littlest, her name is Leah, and she's 6 years old.
Sylvia speaks with us through a Camino interpreter. You don't have insurance?
No tiene seguro.
No, no tenemos seguro.
No, we don't have insurance.
And you're not covered by Medicaid?
Y no estás cubierta de Medicaid.
No, no tenemos Medicaid.
Yes, it's super scary. It's super, super scary. And if we don't have insurance, what happens if we have to go to the hospital? Then we'll have to end up paying so much and at high costs.
Meanwhile, PBS NewsHour also caught up with Kenneth Small, a self-employed landscaper in Rowan County, who credits his free clinic in Salisbury with helping him survive heart surgery, both physically and financially.
I've never paid out of pocket to come here anything. So they're filling a large gap between people that are making too much money to qualify for Medicaid and can't afford insurance. And that's where I fall in.
We have 1.1 million uninsured folks in North Carolina. What we hear is that Medicaid expansion will cover about half of that.
North Carolina is now the 40th state to expand Medicaid under the Affordable Care Act.
PBS NewsHour's national correspondent John Yang picks up our story at the state capitol.
When North Carolina's Medicaid expansion is fully implemented, an estimated 600,000 people will gain access to health coverage.
Hey, B, what you doing?
Like Evita Bass, who works in childcare in Hillsborough and didn't qualify for Medicaid under the old rules.
You're an assistant director here.
I am.
Work full-time.
I do.
But no health insurance.
No health insurance.
Now, are you constantly worried about what happens if I get sick? What happens if I have an accident?
It's very hard to keep yourself, up there, but I do what I have to do so I don't have a doctor bill.
They can.
Last year, Bass, who's 30, had emergency surgery that left her out of work for a month and stuck with more than $36,000 in debt, an expense Medicaid would have helped pay.
One thing I've always lived by, better late than never. You kind of just got to roll with the punches. Granted, I wish it would have came a little bit earlier.
If Bass qualifies under Medicaid's new income requirements, as she believes she will, she says she'll enroll as soon as possible.
And then how quickly are you going to make that appointment for a checkup?
As soon as they approve me.
Last month, Governor Roy Cooper, a Democrat, signed a bill passed by the Republican-controlled legislature expanding Medicaid access in the state.
We have a Medicaid expansion bill.
When it's implemented, the program will be open to families and individuals whose incomes are lower than 138% of the federal poverty line. That's about $20,000 for an individual. Before expansion, most adults without children or a disability weren't eligible at all, no matter how low their income. State Representative Donnie Lambeth is a former hospital executive. Since 2017, he'd been trying to get his fellow Republicans, who controlled both legislative chambers all those years, to pass expansion.
So it was really an education process to get your fellow Republicans on your side.
Exactly, and I think when you first talk about expansion, it's like, and this was what they said to me, oh no, we're expanding another government entitlement program. The neat thing about this program is it doesn't cost the state any money.
In all, the expansion and a one-time federal bonus is expected to bring in $8 billion a year for the state's healthcare providers. The state government's contribution to the cost of expanded coverage will come from hospitals, not taxpayers.
Back here in Charlotte, Atrium Health, North Carolina's largest Medicaid provider, calls the expansion a big step forward for our entire state that will usher in a healthier tomorrow for all. But the smaller, low-cost clinics like Camino worry about their poorest patients who still won't have health insurance, even after Medicaid expands.
Unfortunately, for the community that we serve, that doesn't offer any relief.
Desafortunadamente, para la comunidad que nosotros servimos, el Medicaid siendo abierto no les da apoyo.
No, it does not cover them.
La expansión del Medicaid no cubre a las personas que ya están viviendo aquí.
Absolutely. I think for us, the priority continues to be this community that is uninsured, that is underserved.
Sí, obviamente para nosotros la preocupación sigue siendo las personas que no tienen seguro, que están servidas de menos.
And that are under-prioritized.
You know that North Carolina expanded Medicaid, but that doesn't help you, does it?
No quieres un regalo, quieres ayuda.
Quiero ayuda, no regalo.
Yes, I want help, not a handout.
That's the saddest story, when older folks who need health care, when young children who need health care don't get the care they need.
Sí, nos sentimos callados, frustrados, que no hay alguien que nos alce la voz por nosotros.
Yes, we feel silenced, we feel that frustrated, we feel there's nobody to help us elevate our voices.
Yeah, elevating those unheard voices are why Camino leaders were in Raleigh shortly after the governor signed that Medicaid expansion bill. They were thanking lawmakers for their help, but also reminding them that for now at least, they're not helping everybody who needs it.
Thanks for watching, and if you don't want to miss any more great regional stories, please subscribe to our PBS Charlotte YouTube channel.